So, uh, what should I say? This is a typical Indian story of talent of a young girl who, in 1999, she dared going across the threshold of her conservative family and decided to do MBBS. Right, that time it was not very much cherished here in India that for medical or engineering, but that's why I use the word conservative. Right, she did her MBBS from Pune, Maharashtra, and immediately after that she dreamt of going to US. Right, and for that she cracked USMLE, all three phases, all three steps. That's it. So after that, I mean to say, she went to US and did her USMLE. So here, guess who is going to be with us today on this channel, this podcast? It's Dr. Neha, who currently is living since last 19-20 years in US, San Francisco, and she is an impeccable, suitable case study for the whole, Indian education fraternity. I mean to say, whosoever are currently in US planning to come to India for MBBS, and naturally they would also be writing this USMLE. They may choose US in future, having cracked their NEET, having done MBBS in 5.5 years. Right, that's it. So I mean the one and only one, Dr. Neha, who has the authority over the experience of this journey, and today he is with us. Thank you, Dr. Neha, to this podcast. First of all, thank you very much for giving such a valuable time, out of
Thank
your
you for
so busy schedule. You are here in Delhi, and I know that the winters have started. So, I mean, you are here for how long? I mean, this
I'm here for 2 weeks.
two
This
weeks.
visit, yes, yeah.
Right.
Thank you for having me.
Thank you, ma'am. The thing is that we especially invited Dr. Neha to this podcast, as we said that she has a good command, good authority over the experience of the journey, and there is no one more suitable than her just to give us an insight into this journey. Right? We'll be asking her many questions. So, ma'am, I'm sure you are very much comfortable and ready.
Yes.
Because this podcast would be watched by the whole US Indian fraternity, whosoever are venturing into NEET or even JEE. So, the nature of NEET and JEE both are same. Right? So, Dr. Neha, for MBBS here in India, for USMLE, and then the further career into medicine in US. Right, that's it. So each and every word is going to be important for her. Have a cup of tea, sit peacefully, and go through this podcast. That's it. So, ma'am, the thing is that the very first question, that goes to you. What basically was your experience of doing MBBS from India?
I grew up in India, so all of my primary education was in India. So I think for an Indian student who grows up here, it's a good experience being outside your house the very first time. It's a little bit scary initially because you have to live in a dorm for those 5.5 years.
It's scary in what sense? Something
Well,
abnormal, or that is coming from the society or the surrounding?
No, it's because you're very protected when you're living with your
Right.
parents, and then you suddenly have to manage everything by yourself,
Gee.
all your food, your laundry, your studies, and there's nobody overseeing your care.
Your parents are not with you.
The parents are not there
So
with
till
you.
yesterday you were a pampered
Yes.
child, but today you have to manage everything on your own.
Everything. So it's like suddenly entering adulthood in many ways. So I think the first 6 months were a little bit challenging because it took some time getting adjusted to living in the dorm, being in a medical school, having to handle so much course workload right away. But then the subsequent 5 years were really amazing because you end up making so many new friends, and it's a new, different form of learning. And that's when you start becoming independent by yourself. So I think the subsequent 5 years, despite the course load, it was a very fun time. And in fact, some of my closest friends are still my undergrad friends from MBBS. So I think that time was really invaluable, like much cherished time. And I think all students should have that opportunity to stay in a dorm and make lifelong friends.
So after some time, having spent 2 3 months, you got
Yes.
used to that life.
Yes.
That's it. So for that, you were living in a hostel because
Yes.
it could be a matter of concern for those students who are abroad, US
Yes.
especially, and they are planning to come to India.
Yes.
So you were in a hostel.
Yes.
Okay. So what about the atmosphere of a hostel, food, etc., the amenities and all?
So I went to a government hospital, a
Mhm.
government school. So like by proportion, like some of the facilities at a government funded school or a dorm, they're not as good as some of the private colleges offer, but I think they were quite decent, very reasonable. For the first 1 year, it was a shared room with a roommate. But after the initial first year, we all had our own independent rooms. So it was quite comfortable, I would say.
Any memories that you would like to cherish from your hostel life?
Hostel life, yes, yeah, of course. I remember bunking the 8 a.m. lecture, sleeping in late because we kind of went watched a movie the night before,
I
or we
see.
were partying late.
Oh,
So that's just a part of like a
that's a
normal
part of
undergrad.
normal life of
Yes,
a student who
yes.
has gone into the college.
Mm-hmm.
So if he doesn't make mistake during that time,
Yes.
then he doesn't get time to
Yes.
make such beautiful mistakes in future.
Future, yes.
So fine, that's great. So in MBBS,
Yes.
you did it for 5.5 years,
Yes.
right? Along with the internship.
Yes, that so the 5.5 years includes the 1 year of internship. Yes.
What basically is a typical internship for MBBS here in India?
So internship is just the complete practical, the application part. So you do your classroom courses for 4.5 years, after which you are completely capable of being a junior doctor at any of the government hospitals. And so it kind of just builds up on the training. So for 1.5 months, you'll be in a medicine ward. Another 1.5 months, you'll be in a surgical ward working as a junior intern under your surgical residence or medicine residence. Then about 2 to 3 months, you have to do some community service. That's a mandatory part for all Indian students. I think it is 3 months now, where you actually go to a rural hospital, which is called a peripheral health center. And those 3 months, you go and serve in that peripheral health center. And I think that's a very valuable part of training because I had never been to any rural place or a village prior to that. So part of my training was at this village called Shirur, where I had to go stay there. I'd stayed there, I think, for 3 weeks, if I recall correctly. And that was quite amazing because the kind of patients you see is very different because these are like otherwise healthy farmers, healthy people who are very physically active, and they might come in with some minor injuries, work related injuries, maybe some malaria, some fever. So the kind of patients you see in a rural setting is very different. And the kind of affection that you get from the patients is very different because they're very grateful that somebody is coming.
Here in India, people have a great faith in doctors.
They have a lot of faith in doctors. They're very grateful that a batch of students is coming to help them and to help the children with the vaccinations. And essentially, that's kind of what it is more like family medicine, taking care of pregnant ladies, of children, and mostly working people who might have suffered some injury. So the patient pathology is different when you're serving in a rural area. And then the remainder part of your internship is essentially rotating through some other clinical specialties, which you can elect to rotate through ophthalmology, you can elect to rotate through pediatrics, or these are called some elective rotations, which you can pick and choose depending on which area you're interested in.
Right. So during your exposure to the the patients in the rural part,
yes,
where were you staying? You were staying in the same hostel, or you were staying somewhere the local place?
So all peripheral health centers in India, they have their own dormitory for the students. So the term that is used is called PHC, Peripheral Healthcare Center. And most of these, they are manned by medical students from various colleges. So they have their own site facilities.
So after that, you had your farewell.
Yes.
So when did doing this USMLE,
Mm-hmm.
cracking this USMLE, and then going across the seas
Yes.
to US,
Mm-hmm.
when did it come to your mind?
So that was
And
during.
most importantly, why did it come to your mind?
Yeah. So I think I decided to start studying for the USMLEs during my fourth year, the last
No, but
year of
had you
MBBS.
wanted,
Yes.
you could have done MD from India.
Yes.
So, but why US?
So one of my reasons for looking out for US was because in India there are like so many medical colleges. There are a lot of students who graduate the same year, and the number of postgraduate seats for medicine or surgery or OBGYN or pediatrics, these are actually quite limited. So I was not very confident if I'll be able to get into a proper clinical branch. And I really wanted to do
So,
medicine.
in a way, are you saying that doing MD, if I'm not
Yes.
wrong, doing MD in India is difficult,
Yes.
but doing assembly for US is easy rather?
So for clinical specialties where you have a one-on-one patient contact, so your clinical specialties are like medicine, surgery, obstetrics, pediatrics, or orthopedics, where you have one-on-one interface. So these are the pure clinical specialties. Then there are some non-clinical specialties, which would be like pathology, microbiology, radiology, where you're still taking care of patients, but not in a
When you
one-on-one
are saying
manner.
this all, I just fear too because I don't love to go to the doctor.
Doctors, this thing. So I think for India, like getting into a core clinical specialty is just a little bit harder because there are a lot of students who graduate, MBBS students who graduate in a year. And in comparison to the number of graduating students, the number of positions for MD or MS are actually very little. So it's very common for students to have to prepare another year or two, or at least give 2 or 3 subsequent attempts till they get into a MD or MS position. And I just didn't feel at that time that I had the patience to like kind of wait another year or two. So
Yeah.
I wanted to just continue being in a school or continue my studies without a break in between. So that
Right.
was like a big factor for.
Big factor to decide that you will
Yes.
be going to US.
Yes.
Right, that's it. So your thought for USMLE started. You were in third year. Am I right in saying?
Around like third to fourth year. Yes,
Fourth
last
year.
year.
Let's say fourth
Yes.
year. So it when it started in fourth year. So what was the first thing that you did in order to go for USMLE? I mean to say now little bit of academic part and all.
Yes.
You're planning and you're starting this academic journey,
Yes.
which is called cracking examination here in India.
Yes.
And that basically is a thing which is seen here in India in a very high esteem.
Yes.
I can tell you that students of whatever caliber, from whatever background, whether rural or whether son of a millionaire or son of a farmer, daughter of a even cobbler, rickshawala,
Yes. Mm-hmm.
they basically go for the government examination.
Mm-hmm.
Right? Many doctors these days here in India having cracked this MBBS.
Yes.
Now, what they are doing that they are going for civil services.
Okay.
At the time around year 2005, when we migrated from India to US,
Yes.
that was a high time when the people would be thinking in a very conservative way. Why? I have my degree in MBBS. I'm already safe. I can join any hospital.
Mm-hmm.
That was the time when this thing was rising here in India.
Okay.
The rise of the private sector of medical. I mean the
Yes.
hospitals.
Okay.
5-star hospitals, 7-star hospitals.
Yes.
Right? And that time must have heard about here in Delhi, all big chains of hospitals. You could have easily got a job. Okay. But you never thought that. You never thought of writing this UPSC or other any uh, government examination. Say, I mean, you could have joined Indian Army, but there are many posts over there for medical, the doctors in the core army sector.
Mm-hmm.
You never thought of this.
No, because UPSC was never even a consideration because I wanted to do pure clinical medicine.
But here in India, what people say, कि एक बार यूपीएससी जरूर देनी चाहिए.
Yeah.
You should definitely write it once. Right? If you are an Indian and if you think you are talented.
Yeah.
Right? That's
Yes.
you never thought.
No, because then I think it also relates to your primary interest, right? My primary interest was not to be a public official. My primary interest was to be a medicine doctor.
Right.
So, like, I think that's kind of what drove all the decision making, that I want to be like a primary medicine, like a general practitioner. So,
I'm good. I think that this part is going to be very much theoretical. But Dr. Neha is the best person to describe what USMLE is and what are its different phases. Though there are many videos over here on our channel where we have tried to define this very clinically, but it is good to hear the USMLE. I mean, its definition, its other components in a very pragmatic way, in a practical way, from Dr. Neha. So, ma'am, USMLE, right? What is USMLE? What are its different phases? From where it starts, where it ends?
Okay. So USMLE is essentially the US medical licensing exams. That's the full form of USMLE. And there are 4 steps to your USMLE. So the part 1 and the part 2 are purely computerized tests, just like your SAT or like your GRE, GMAT. So it's the same format as the part 1, part 2, a computerized test. And then the part 3 is actually divided into 2 parts. Which is a 2-day computerized test, and after that you have to do a viva sort of. That's your next part is where, and for that you have to be there in the United States physically, and you have to do some.
But for that, it is also important that you crack USMLE Part 1 and USMLE Part 2.
Yes. So these are all sequential exams. You have to complete your Part 1 first, and then that is followed by your Part 2. Then that is followed by your part 3, and then after you've done your part 2, that viva part can be scheduled anytime. The in-person viva can be done anytime.
Is it that you can write USMLE as many times as you want, or there are some limitations?
I don't, at my time, there was no limitation, and if you don't have a good score.
We are in year 2024.
Yes.
There has been limitation.
I think now you can attempt each step about 3 times. I think they have a limit now.
And having spoken with the students who have written this USMLE, what they gave me insight that it is also not too good just to make many attempts of USMLE phase 1 and phase 2, which is known as clinical knowledge.
Yes.
Right, because it affects your migration potential, immigration potential from India to US. Probably it doesn't put that much good weight on a CV and all.
I don't think they look at your scores. During your viva.
No, I'm talking about the number of attempts. If you have cracked this USMLE in first attempt, that's really good. But if one is doing this 3 times, 4 times, so probably that is not seen in a good esteem.
Probably, it would not impact your visa interview. I don't think it's related to immigration or the visa interview in any way, because I really doubt that they even have access to the exams or the exam scores. But yes, while you are submitting your application, so the system is a little bit different. So in US, there's no centralized application. So you have to apply separately to each program where you want to interview. Then you are invited for an interview if they like your application. So you go, you meet all the professors, the faculty at that particular institute during your interview day.
Right.
And then they decide whether they want you or not as a part of their school. So that is how the system works. Yes.
So what I have learned, correct me if I'm wrong, that USMLE Part 1 is basically purely theoretical.
Yes.
You simply ooze out in the paper your theoretical knowledge.
Yes.
And the student here in MBBS in India, they also relate the 19 components of whatever they have learned in MBBS in order to crack this paper.
Yes.
USMLE paper.
Yes.
Yes. Now, what is, so I have cracked it.
Yes.
Okay. Now, what is USMLE Part 2 that is known as CK?
Yes.
Clinical knowledge. What is that and how different it is from USMLE Part 1?
So USMLE Part 1 it only covers your basic fundamental subjects like biochemistry, pharmacology,
Yes.
physiology. So that's your basics, what you learn in your MBBS year 1 and year 2. So that's the Part 1. And it's a purely theoretical exam, very similar to your MBBS 1 and 2.
Right.
And so the part 2 of the USMLE is what's called the clinical knowledge. So that is subjects like
Why
medicine,
I'm asking this
surgery.
question to you?
Yes.
Because there are many students, because
Yes.
as an Indian student, you are supposed to be good. If you have the theoretical knowledge,
Yes.
you get 100 on 100
Yes.
and all. But this CK, even I was confused then when I was speaking to some
Yes.
students.
So CK is just a different, it's just your MBBS year 3 and 4 subjects. So the subjects is just different because those are clinical subjects like medicine, surgery, obstetrics, pediatrics. That's why it's called clinical knowledge. So that's what part 2 is.
You mean to say, in a way, you are saying that before writing USMLE to CK,
yes,
I should have a practical exposure to medicine and surgery?
Yes. So without having rotated through medicine or surgery, it would be very difficult to actually be able to study for part 2 CK.
So you mean that generally in third year, or I am taking your exam,
Yes.
that you wrote your ESMLE, you started your preparation for ESMLE
Yes.
when you were in fourth year of MBBS.
Yes.
Right. So when you were in a fourth year of MBBS, you hardly must have got a time of 1 year or 1 and 6 months.
Yes.
Right. So when you wrote, when did you write this ESMLE part 2?
So I did all of my exams when I went to the United States. I would not recommend anybody does that. So it's better because it's the same course. At the end of the day, your subject matter is essentially the same. The only thing that's different is the format of the test. So while you're in your MBBS, in your year 3, year 4, you're very fresh with all the subjects that you've studied, the fundamental subjects, which are your biochemistry, pharmacology. These are your basics. So you are very much capable of completing your USMLE step 1 when you are in your MBBS year 3, or once you've kind of completed your second year of MBBS. That's the ideal time to give your USMLE step 1 as well.
Right.
And during your internship, you have a lot of time in between. There are some elective rotations where you're not constantly working. So that's a very good time to complete your USMLE step 2 because that's your pure clinical test, and you just finished completing your vivas for medicine, surgery, and all the clinical subjects.
So you are strongly advising the students
Yes.
that they should write their ESMLE CK,
Yes.
which is phase 2,
Yes.
when they have completely finished MBBS for 4.5 years.
Yes.
And the time when you you have been exposed to internship,
Yes.
is that the right time to go for this?
Yes, that's the right time to go for it because you just prepared for that for your MBBS final exam. And let me be very clear on this, your MBBS final exam is much harder than the USMLEs. So if you've managed to pass your MBBS final for your medicine, surgery, pediatrics, you're very, very well prepared for USMLE as it is.
But USMLE, which part? Part 1 or part 2?
Part 2, because your MBBS, you completed your MBBS with your medicine, surgery, with all the clinical subjects.
Right.
And it's a lot more rigorous. Your MBBS final is a lot more rigorous than USMLE is.
So I mean to say that the level of difficulty that
Yes.
MBBS final
Yes.
exam generates,
Yes.
with that preparation, probably cracking along with your MBBS final,
Yes.
this USMLE CK is not a difficult task.
It's not a difficult task, no.
Right. Rather they
because the course
complement each other.
material is the same, right?
Yeah,
It's the same.
they complement each other.
Yes.
Am I right in saying?
Yes. Yes.
Right. And then you do your internship.
Then yes, then you have to do your internship.
That we have already spoken that
Yes.
what actually happens during the internship. Okay, that's it. So 5.5 years.
Yes.
Okay.
Yes.
Now, by this time, I have finished my MBBS. I have finished my USMLE phase 1.
Yes.
I have finished my my MBBS final.
Yes.
And ideally, I should finish my USMLE part 2.
Yes.
Is it fine?
That's correct.
Now, only one thing is left here.
Yes.
After this, I'm left with my internship.
Yes.
And then I'm left with my USMLE Part 3.
Part 3 and the Viva portion.
Viva portion of what?
So for USMLE, there is a in-person Viva portion as well. And I'm not entirely sure what it is called, but that is something which you can
Is
give.
it called clerkship or articleship?
No, that is not the same as clerkship. It's essentially a half-a-day exam where you have simulated patients.
That's a 2 days exam, if I'm not wrong.
That is just
I read
one.
it somewhere recently.
That's the part 3, which is a 2-day exam.
Part 3 I'm talking about.
Yes.
Yeah.
So part 3 is a 2-day exam. Part 3 is a 2-day computerized exam. So that's the same as your part 1, part 2. The only difference is in part 3, they don't test you for the theory subjects. They will give you patient vignettes. So they will give you patient cases. That's what part 3 is.
So you are allowed to go to a patient in US hospital?
No, these are, I think there's a little bit of confusion. Part 1, Part 2 and Part 3 are written exams. These are computerized exams. Apart from these 3 exams, there is a Viva portion.
Okay.
Where you have to physically...
That's the 4th part?
Yes, that's like, we can call it Part 4, but the term is different for that. It's
so
called
Part 3 is what actually?
It's called Clinical Skills Assessment. That is what it is called.
Okay.
So...
CSA?
Yes. Clinical Skills Assessment.
Part 3 CSA.
Part 3 is not CSA. Part 3 is just Part 3.
So what is in Part 3?
So Part 3 is a computerized test, which is a 2-day test. And in the test, the questions are patient cases. So they will give you, the question will start as like a 79-year-old man comes with you with complaints of this, 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 and this. What is your diagnosis? So that is Part 3. So all the questions in Part 3 are cases, examples.
Case study.
Yes, where you have to apply your knowledge.
Okay.
So that is Part 3.
Yeah.
Apart from that, there is
you have to apply your knowledge by writing the solution on the paper, or you have to type in.
These are all MCQ based questions.
Okay.
So these are all multiple choice.
Okay.
There's no writing involved. No. Yes. Okay. And clinical skills assessment is a completely different thing, and that's a required exam where you have to be at a United States center in person.
For Part 3 of USMLE, you have to be in United States.
Yes, Part 3 also you have to be in United States. For clinical skills assessment, you also have to be in United States.
Yeah.
And that's a half-a-day exam where you will get 10 simulated patients. Simulated patients means these are people who are pretending to be patients. So there would be like somebody like an actor sitting in an exam room pretending to have like knee pain or back pain, or they'll be pretending to have some symptoms. So you go, you talk to your patient, and then you come up with a diagnosis.
Yeah.
So so they're checking your one-on-one interaction, they're checking your English speaking skills, and they're just checking your bedside manner in that particular...
Your temperament as a doctor.
Yes, yeah. So that's the Viva part, and that is something which you can only do in United States at one of their designated centers.
Great. I mean, it's a great practical way of conducting the exam.
Yes, yes, yeah.
It generally doesn't take place here in India. That's it. So really, so great to know. So now we have done USMLE Part 1, 2, and 3.
Yes.
And we have also done Viva.
Yes.
So Dr. Neha finished her journey for MBBS and USMLE this way, right? Now the phase comes when she has to venture into this world of medicine in a very simple way, treating the patients, right? So let's talk about that part now. Okay, her the challenges that she faced, the problems, how she adapted to that. These all things are very very important, right? Because here this is the phase of a doctor's life where whatever he has learned practically, learned theoretically, now he has to go for the application part.
Yes.
That could be very challenging. So how did all started then?
So after you're done with your US licensing exams, then you apply into your residency program. So residency is the equivalent of MD or MS in India, what we call MD medicine, MS surgery.
Yes, that you decided to skip?
Well, you cannot skip because in
That
United.
you decided to skip in India.
Yes, yes.
Yeah.
So I was not very confident of being able to get MD medicine in India, and that's kind of what prompted my decision to go to the United States
Right.
and try working on the USMLEs instead. So once you are done with your USMLE exams, all the 4 steps, and you also have to do something apart from just your exams, because in United States the system is very different. So in India, everything is decided by your final scores. So your scores or your competitive exam score determines your placements subsequently. But in US, that's not the system. The score is only a very small part of your application. The scores, they count, but that's not the only thing that they look at, because it's an actual in-person interview. So your statement of purpose is very important, and then they look at all the additional things that you might have done, any volunteer work or any kind of research work or any kind of research project or an internship which is outside of your regular routine work is very important, and that kind of adds the most weight to your application. And in United States it's a little bit different because the students, they pay a lot of money to get into medical school. It's a very expensive proposition.
Yes.
For them.
Well, I have heard it is in order to finish this whole
Yes.
thing, 5 to 6 crore rupees.
Um,
Indian rupees.
Yes, yeah, that would be about right. Yes.
Right.
So it's a very expensive proposition. So it's very competitive as well. So a lot of these students who are applying for medical school there, it's because they really want to go into that stream. And these are the people who typically the students who volunteered a lot, either with like World Health Organization or some other health organization. And that's kind of how the general environment is, the training is. It's more hands-on, more practical. So internship carries a lot more value than your exam score does. And so that is very important to have for all the students, especially international medical graduates who are applying to any US residency program. They should either have some research experience or they should have some volunteering experience in order to give more weight to their application.
Right. So, I mean to say, how long
Yes.
did you work in this phase? This phase, when you started working in a hospital,
Yes.
after that, no examination, nothing.
So once you get into your residency course, so for residency medicine, it is a 3-year program. For surgical residency, it's a 5-year program there. So surgical residency is longer there. And you do have your.
Were you in surgical residency or?
I was in the medical residency for 3 years. So I did MD medicine.
Okay.
So you do have your residency.
You chose to do MD medicine or you chose to do?
I chose to do MD medicine. Yes.
Okay. You didn't want to jump to surgery.
I did not want surgery. No.
You didn't want.
I did not want that. No.
Generally, the surgeons.
Yes.
They basically are given more importance. Here in India, I have no idea about US.
Yeah, it's the same. So the difference between medicine and surgery would be, as a medicine doctor, you become your general practitioner, and a surgeon is a surgeon. And of course, there's a little bit, not a little, I would say, there's a lot of difference in the pay scale. So as is the case all across the world. So if you are a medicine physician, a general practitioner, you do earn less than what a surgeon would. But then surgery comes with, so each specialty has its own pros and cons.
I have a question over here.
Yes.
That may be controversial.
Yes.
What I have heard.
Yes.
I've spoken to many doctors when I was in US.
Yes.
But not to you.
Yes.
On this. That the foreign students.
Yes.
They are discouraged for this surgery branch.
So I would not call it discouraged in a way, but the thing is, like, it's for United States, they have to give preference to their own students first. So United States, they have their own medical schools where a lot of students are graduating from their own schools. So many of the US medical graduates, they prefer surgical branches, and a part of it being because all the surgical branches are better paid branches. And many of these students, they graduate with a huge amount of loan which they had taken for their medical school studies. So many of them, sometimes even if they're wanting to go towards medicine, like just because they have such a huge loan, they prefer signing up for surgical branches. And so a lot of these residency programs, because they get so many of their own internal applications or applications from US graduates, so as a country, of course, they have to take their own students first before they accept foreign students.
Mm-hmm.
So for surgical branches, then you definitely, all the foreign medical graduates, they can apply, but then they'll be competing with a lot more students because then they're also competing with US nationals.
Tell me one thing.
Yes.
I think if you see the general mindset
Mhm.
of the students who are here in India, they would, I mean, I can say that the high percentage of a student, they would love to go for surgery.
Yes.
So, isn't it so decisive that the journey that you took, Robert Frost, the road not taken, and at last you came to know that you are not given surgery?
Mhm.
As according to there are the main reason is the huge amount of loan that one has to take in order to get into surgery.
Mhm.
So most of the Indian students who are getting into US for medicine, having done their MBBS, I think that they would be discouraged if they hear that this much of money they have to take into loan. Plus, if the preference is given to native US students, then isn't it a good idea just to that after MBBS they stay here in India and go for MD?
So you have to decide, students have to decide what branch they want, because your chances, it's essentially a probability game. So the probability of getting into a medicine residency is much higher in the United States. Probability of getting into a surgical residency is less. So the students have to decide which specialty they want to specialize in. And a lot of this information is available on Google as well. Like now you can just Google anything, like the probability of getting orthopedics in United States, probability of getting orthopedics in India. Do the comparison, do some research, figure out what you want to do, and then make an informed decision.
That's it. So, ma'am, here in this journey, when you have started this, or anybody
Mhm.
having MBBS, USMLE, all these complexities,
Mhm.
when I'm hearing you now, I get confused sometimes.
Mhm.
But the great thing is that you are explaining this also articulately. What basically is MPH?
So,
MPH.
yes, MPH is Masters in Public Health. So, and that is
How
because,
does it come into the picture? I mean, from where it is coming to the picture?
so
I've
again,
already done my master's
yes,
in
yeah.
medical and all.
Uh-huh.
So why I'm then going for this?
Yeah. So it was a little bit different for me because again, I had not completed my step 1 or step 2 here in India. So I needed some time to work on my steps. And then again, as I mentioned, that your score alone doesn't really make a lot of sense, because when you are in United States, you're competing against a lot of international students, students from China, students from Vietnam, from Africa, from Europe, a lot of Russian students, Ukrainian students. So, and all of the international students, they all tend to have a score which is 99th percentile. So that's not the criteria for comparison. So you have to have something additional. So I chose to work on a research degree, get some research experience, and that's what Masters in Public Health is. So Masters in Public Health essentially is a 2-year course, a master's course, where they prepare you on how to conduct clinical research, how to interpret clinical research. Then you have some biostatistics courses. They enable you to do your own biostatistical analysis. And then I also had those 2 years to kind of get familiar with US as a country in general, kind of network with a lot of other students, talk to residents from other programs. So I use that time for networking, some travel, to learn more about which school to apply to for residency and how to sort of navigate the system. So I think that was actually a good decision because it just gave me like sort of like a soft cushion to kind of gel in to the US environment, get familiar.
Right. The part of this we have already discussed with
Yes.
you. But again, I would be coming to the same point. That's all about the aspiration of a student
Yes.
who is there in US. The theme that we have taken, that you do your MBBS in India.
Yes.
You were in US. You do your MBBS in India.
Yes.
You wrote your recently. Is it a truth that most of the foreign students, Indian students, they are given internal medicine?
So, foreign medical graduates, that's the term which is used for anybody who's not a US national, is a foreign medical graduate. And so, again, it's what we discussed was the probability theory. So, generally, the US nationals who are called US medical graduates, that's the term used, US medical graduates, they tend to apply more for surgical specialties and dermatology. So, these are the ones which then become harder for FMGs to get into because you're also competing with US nationals now. So medicine is a branch which is not very much preferred by US medical graduates. So in fact, I think at this point of time, like if a international student or foreign medical graduate is to apply to any of the US programs, they have a pretty decent chance of getting into a medical specialty, into internal medicine. And you will end up finding that most of your classmates, the batchmates, they're also foreign medical graduates, as was the case with me. So I went to a residency program where we had 35 residents in our internal medicine class, and I think majority were foreign medical graduates, which was actually, it was quite good because then you end up learning from so many different cultures, so many different ethnicities,
The diversity.
a lot of diversity. So it was actually very fun. Those 3 years were very good.
Right. So the thing is that what basically the scope of this internal medicine? Does it give you a good lucrative scope?
Yes, there's definitely a better work-life balance in the United States. Then there are a lot more research opportunities. So anybody who's interested in going into academia, I think it's better they are placed in the United States because you get to work with the latest technologies, you get to work on the latest cutting edge research, and you get a lot of mentorship. So for somebody who has that sort of a mindset, where they want to be in research or even for clinical practice, if they are looking to be in a more modern setup, and if they're wanting to be in an interventional branch where they have access to the latest technology, then definitely you want to do your higher studies in United States because then it's all available there.
Is the society of US,
Yes.
the medical fraternity, is it receptive to Indian talent?
I think the medical fraternity there is very dedicated to their jobs. So US is a country which is made up of immigrants from a lot of different countries, different cultures, ethnicities. So as compared to India, it's like much more open in terms of its mindset. So there's a lot more inclusiveness there. So I thought the quality of
Here,
medical.
sorry to stop you,
Yes.
but you see,
Yes.
right? There are many tech guys in US who are household name here in India.
Yes.
Sundar Pichai, Wanga, Nadella, right? All the Indian students, whether they are in 6th or 7th or 8th, they know them. Sundar Pichai is for Google. The Indian CEOs, the tech guys especially, they are also known for their management skills and temperament. But trust me, I have never heard about a doctor from US. Right? I've never heard about a doctor from
So
US.
our current Surgeon General is an Indian. in the United States.
But that will be
So
a designated post.
so it's not, that is not true. At most of the bigger academic institutions, all the head of departments, all the bigger doctors, they tend to be either Indians or international medical graduates. So it's just that media does not discuss a lot of
Yeah,
doctors in
but
general.
I'm telling you myself. I
Yes.
mean, I have heard about many tech guys, but not a medical guy.
Yes, but that's just because the news is more media savvy, like they're more like tech savvy, like they'll give you, because they earn a lot more. But that's an industry difference. I don't think that has anything to do with the medical fraternity as such, because Sundar Pichai, a person who makes like $10 million or maybe more
Correct.
in a year, is definitely going to be a lot more famous than a physician.
So is
So
that not a substantial amount of money in medical field
uh,
for those who are Indians?
I don't think the salary has anything to do with the nationality, because each field has its own market rate. So for a teacher, there's a set market rate. For a physician, there's a set market rate. For a tech person, there's a set market rate. So it kind of depends on which industry you are in, and that's kind of what decides what your reimbursement, your salary is going to be. So there are these market comparisons which are used, and it's it's the same all across the world. If you're looking to make money, do not become a doctor, is what I tell everybody.
But I've heard
But
about many doctors,
mhm,
in US. I have not heard,
yes,
not so often,
yes.
but I, I just know that they are into this philanthropy. It
Mhm.
means they are earning money and then they are donating to the society.
So it's both ways. Yes, it doesn't, it's not like that if you become a physician, you will not make money at all. Somebody who's financially savvy will always find a way to set up their own practice, expand it. A lot of it also depends. So a lot of it depends on the opportunities you get. Some of it is the time and place where you're at. So there's nothing generic. It's not like if you become a physician, you will not make money, or if you become a physician, you'll make like a ton of money. But in general, if you are in an employed position, you will never make as much as a tech person would. If you are hired by Google or Apple or Facebook as a salaried individual, as a salaried entry level individual, you will always have a lot more income than an entry level hired physician would. And that, by a hired physician, I mean both a medicine physician as well as a surgeon, because that's how the market compares. Like tech as an industry just pays more.
How to find the infrastructure, the medicine infrastructure in US, the hospitals and
Yes.
all, and here in India, because you have got the exposure to both the societies.
So I think medical infrastructure is definitely a lot better. It's all the cutting edge technology, the latest advances. These are all coming from either the US generated research or European research.
The technology is coming from US to India,
Yes,
no doubt.
yes. And so that also kind of determines the quality of the faculty that you have, because in US then you have an opportunity to work with the people who developed all of this technology. So I think in terms of the teaching capabilities, my personal experience is that the faculty, your mentors in US, are much better trained, and I don't think they have any inherent biases. In fact, if you're a good student, you'll get a good training anywhere, regardless. So if you're a receptive student, your mentors would like to teach you, and it's a lot of it is just the receptiveness. I don't think nationality comes into a play there.
What is the truth of this fact that in US it takes more than months to get appointment from a doctor?
So that is just a structural problem, organizational problem, and the system of medicine is very different because insurance is mandated in the United
Yeah.
States. So when
Nowadays, when people are counting their expenses
yes,
in US, they are also counting this welfare
healthcare,
funds,
yes,
healthcare.
actually that's one of the biggest expenses now as you
Yeah.
get older.
400, 500
Yes,
dollar per month.
yes.
Yes.
So your biggest expense is actually your healthcare now. I think after your home rent, after housing, is healthcare is the next big expense. And a part of it is just a systematic failure. Whenever a country mandates insurance, then the physicians are kind of stuck in a situation where they cannot charge like a physical fee or a cash fee from a patient. So that sort of kills all the competition. So then the physicians kind of, they do become stuck with the system where they have to work with a big employer who can contract with all of these insurance companies. And so that reduces the availability of physicians. So that is very true that the
But isn't it so strange that I'm having some problem now
yes,
because it demands urgency
yes,
on the part of the doctors,
yes,
and I have to wait for a month?
yes. So that's also depends on the location, I guess. So in many of the bigger cities, there are a lot of other macroeconomic factors at play here. And I'm not sure if we can discuss all of that on this
Yeah.
podcast, but it's a lot of macroeconomic factors which determine this marketplace, the scenario. But it doesn't limit a physician's ability to practice on their own. So if they were to go to a smaller place, a smaller city where there's more scope for a private practice, they can always set up their own private practice. It's a little bit different in bigger cities and bigger metros because then you're competing with very big hospitals. So that's not a very favorable environment to set up your own practice.
I see. And what about this conundrum of at least $250 per patient fee? That if even if I have got a scratch,
Uh-huh.
I have to pay at least $250 for consultation.
That's just the standard market rate there because the
250, it's a big amount. 20,000 rupees
yes,
just for
yeah.
this.
When we compare it to the Indian rupees, of course it's expensive, but for a person here in India, if they have to pay 1,500 rupees for a consultation,
Not
that's
even 1,500 rupees. He'll go to a local formula, pharmacy person.
huh.
He's at the shop. He'll give it 20 rupees ointment. He'll rub it and he's fine. I'm telling you, it is a truth.
Yes, yeah. I think
Even I
healthcare.
have done it many times.
Yes, yeah. I think healthcare in India is definitely better because I think there's a very open marketplace here. They've not killed the free market, not yet, but I think the US system is coming here as well, which would be a bad thing for India too. Like if everybody starts having insurance, it will
But
become the same thing.
I'm telling you, when I was quite young and I would often fall ill,
Yes.
sick, my dad would be taking me to doctor, and in rainy season, I would definitely fall sick twice or thrice. He will take me to the doctor.
Mm-hmm.
He was a very good doctor, was known in whole state, and he would just charge 20 rupee of fee. Will give me some medicine of 2 rupees, 3 rupees, and I will be fine. I mean, presently, if one is ill, then trust me that the cost of diagnosis and then the medicine and all.
Yeah.
Right. That time there was no diagnosis. He will
Yes,
just
yeah.
write the medicine and I'll be fine.
Yeah.
So
So that's like the difference in just the general marketplace because in India, like you have these private diagnostic centers, private labs. I can have a phlebotomist come at home, draw my blood, get my results tomorrow. But there are a lot of like these legal issues. So in US, all of these things are not possible, which makes everything expensive then. It makes healthcare very expensive.
right. So whatever words are coming, from you, these are going to be great insight practically for those who actually is happening these days in US, that a good amount of students, whether they are a green card holder or OCI or PIOs or the wards of the expatriates, mostly they go to US on H1B visa.
Yes.
So they basically are now flocking towards this Indian medical infrastructure,
Uh-huh.
the colleges and all,
Yes.
because of the money factor
Yes.
and then the certainty factor also.
Yes.
Right from the first day, having done grade 12th, I know that I would be doing MBBS,
Yes.
which in US takes 12 years, 13 years. If that also, if everything goes as per your scheme.
Yes.
Right?
Yes. Yeah.
So in India, it's very straight.
Yes.
Okay. So they basically have done MBBS. They have a natural gist
Mhm.
that I have done it from India now. Again, I'll go to US.
Yes.
वहाँ मैं डॉक्टर बनूंगा.
Mhm. Yes.
So the thing is that now, having touched all the aspects of the journey,
Mhm.
right, with Dr. Neha, now you must have understood that once you are now concluding this podcast,
Mhm.
why all her words are so important. I mean, she has touched all the aspect, her views, general views. Okay, I mean, she chose not to do MD. She chose this, and there is a repercussion of every choice. But she is in a very comfortable position just to give advice to all of us that, I mean, we are at short of time, otherwise there are a lot of things that we can do. But in this podcast, whatever ma'am has explained is more than sufficient just to give food for a thought that this is the way, these are the pros, these are the cons. Listen to this podcast again and again very carefully and try to spread it in your community. The words of Dr. Neha. Ma'am, thank you very
Thank you
much
so much.
once again for giving your valuable time
Thank you.
and to give your very valuable insight, right? In future, whosoever takes this path, definitely Dr. Neha would be ideal for them. Thank you very much. Keep on joining us. Thank you.
Thank you.